Hi, good morning. Thank you for the opportunity to speak today, Dr. Berg, Dr. Lowry. I appreciate the ability to share our research at Jefferson, where we have a very active telehealth and telemedicine department. So what we did is we decided to evaluate whether or not the patient satisfaction with the telemedicine encounter would vary depending on how far that patient was from our institution. Just, let me see here. Yeah? Okay. So obviously I'm with a very experienced group, but just by way of reminder, Telemedicine Encounters is the use of a video conferencing software system to conduct patient care visits. And it allows for remote encounters while providing face-to-face visibility. Benefits of this have been studied across a wide variety of medical specialties, and urology is no exception. Multiple studies show high patient satisfaction with the telemedicine encounter, including time spent with the physician, the ease of the interaction, the personal aspect of the visit. As I said before, urology studies corroborate this data and also show that physicians, in addition to the patients, have a high satisfaction. Benefits include equivalent patient outcomes with regard to medical parameters, so there's no shortchanging of quality of medical care delivered to these patients through the telemedicine encounter. There's decreased time lost at work, decreased out-of-pocket expenses to the patient. In some cases, copays may be actually less than an actual office visit. Potentially, there's decreased waiting time to meet with the physician. And because of the increased flexibility that it allows the patient follow-up may be more likely to happen with less loss of follow-up. So with regard specifically to travel time, essentially that travel time goes away. There are some exceptions. There is the proxy visit, which a local physician may provide a physical exam details as the patient is traveling locally rather than to a farther distance for a particular specialist. We eliminate the gasoline costs, we eliminate the wear and tear on the car or the tires, and of course, if you come to Center City, Philadelphia, you pay through the nose for parking, so that gets eliminated as well. So again, we set out to decide whether or not distance to the physician's office will affect the patient's satisfaction with the telemedicine encounter, suspecting probably that the farther they would have to travel, the more likely they would be to be satisfied with this visit. Said another way, does the distance avoided actually improve patient satisfaction? So at our institution, probably similar to most everybody out here, we use the video conferencing system. Each physician is in their private office during the visit, so these are not conducted in a public space or in a joint workroom. And then the video conferencing software is installed by the patient with the help of a telemedicine staff that we have here at Jefferson that are dedicated to a seamless transition from the office visit to the telemedicine visit. The patients get to choose the device on which they upload their application, and approximately 24 hours or so, or the morning of the planned visit, the telemedicine staff will actually do a mock run-through with the patient to make sure that all the systems are go. Additionally, when we started our program, we would have on-site staff from the telemedicine division, which would help ensure that the physicians also had a seamless opportunity to meet with their patients. At the completion of the visit, the patients were asked to fill out a 2-question satisfaction survey, rating their satisfaction with their encounter with the provider, and then the use of the system software itself. And this was on a scale of 1 to 5, 5 being the most satisfied. So we went back and we looked in a retrospective fashion at all of our telemedicine encounters from the inception of our program in the Department of Urology between October of 2015, and this data is through August of 2016. I do have some updated data I can share with you as well. All of the visits were for established patients, so these were not used for new patient visits. We extracted the demographic information from our electronic medical record. We extracted the diagnoses. And then we calculated the travel distance between our office and the patient's home just using common map software. We use the Spearman coefficient to correlate distance and satisfaction in a nonlinear fashion. So between October and August, we saw 424 telemedicine encounters. That's spread over approximately 12 providers. We had 219 respondents to the survey, which was 52%, which is actually very, very high for a satisfaction survey. This may be because it was right after the visit and popped up on their screen rather than having to mail a survey afterwards. But nonetheless, we were very pleased with having over 50% participation. The mean age of the patient was 54 years old, but you can see that they were as young as 18 and as old as almost 90. As one would potentially expect in a urology office, 72% of the patients were male and 28 were female. The mean encounter length was just under 8 minutes, and the patient wait time was approximately 10 minutes, which again was very favorable considering sometimes in our office it's unfortunately a lot longer than that. Overall, the satisfaction was very high with both the system, with an average of 4.6 out of 5, and the provider, which was 4.92. No bragging, but we were very pleased with that. The 5 most common diagnoses that were seen by telemedicine encounters were patients who were post a vasectomy, so just for follow-up on their healing process, and then some counseling. Patients with prostate cancer, and this was a wide variety, either those who had just had prostate surgery, there were a few who had new prostate cancer diagnoses, some were follow-up for active surveillance, or for just follow-up for after care. Kidney stones, urinary tract infections, and then elevated PSA. And you can see across the board, patients were extraordinarily satisfied with their visits, both with the system and with the provider. Looking more specifically at the travel data and the distance data, the mean distance avoided was 27.3 miles, and that range was anywhere from 0.4 to 1,165. Somebody was on vacation and called in, I believe, is that outlier.
I'm sorry. Was the provider who saw them licensed in that state?
That I can't answer. I think they were in the very, very, very far northwest corner of Pennsylvania.
Right.
There was no significant correlation found either between the distance and the satisfaction with the provider or the system. So on average, patients saved 27 miles of travel distance. However, the satisfaction of the patient clearly did not change with the distance that they had to travel, because we had patients who were literally right around the corner who were very pleased with their telemedicine encounter. And then, of course, the person who got stuck up in Erie probably was happy to call in.
Is that your provider was in Oklahoma at a conference and still saw the patient, hence the distance?
Noted, thank you.
Sorry.
That's okay. We couldn't calculate the time saved, although other studies have done so, because we didn't have that data available. And as an urban location and patients coming from within the city, we did not have their modes of transportation. Traffic patterns were variable within the city, so we couldn't calculate that. There was a study from Vyers et al. Looking at the population in Minnesota in the Mayo Clinic Urology, who noted that in post-operative radical prostatectomy patients undergoing telemedicine encounters, they avoided an average of 95 miles of travel distance, and obviously they all drove 65 miles or 60 miles per hour because they also saved 95 minutes of travel time. So Telemedicine encounters are well received across a wide variety of urologic diagnoses. We had no patients who reported a satisfaction score of less than 4. And this included even sensitive information. So even having a discussion about just finding out that they had prostate cancer, for instance, did not necessarily lessen their satisfaction. We feel that it's best suited to discussion and follow-up, management and planning, as opposed to physical diagnosis, especially in the urologic world, where physical exam might be sensitive. Patients should be offered telemedicine encounters regardless of their distance to the medical office. So limitations to this study, we do recognize it's a relatively small sample size. Since we had this data in October, we have, in August, we now have had a total of 611 telehealth visits through the end of 2016 with 289 respondents. So it's still several patients are doing the telemedicine encounters, but it's still relatively small numbers. The satisfaction questionnaire was limited only to 2 questions. The patients were set up to succeed introducing bias, right? We made this as easy as possible for them. Biases also included the patient preference for telemedicine encounters, so they were offered a follow-up in the office or by telemedicine. There was a bias due to cost savings at Jefferson as we introduced this technology. Patients basically were given a free visit. There was no copay at the time, so financially they were incentivized to do the telemedicine encounters. And of course, the bias due to the novelty of the concept. So going forward, what can we do? Well, we are evaluating the efficacy and satisfaction of telemedicine encounters, drilling down to each particular diagnoses. So prostate cancer, for instance, or we've looked at the data for female urologic issues. To expand our questionnaires to try to glean more useful, potentially, information, and then to consider randomized control studies, which are always the gold standard. Thank you very much for your attention. I appreciate the opportunity. Have a great day.